All right, this is the Matrix, which is made by Neuromed Inc. This is a great piece of equipment. I have two of them. We have one here. We have another one right over there. What makes this piece of equipment so unique is that it has an analgesic component. So Advil, ibuprofen, meloxicam, those are all analgesics, anti-inflammatories in the pharmaceutical arena. We can block pain with electricity. It's very well known. There was a Melzack and Wall study that was done in 1965 that opened up the whole field of electroanalgesic. So there's electric stim, there's interferential, there's Russian stim, there's pre-mod, there's all these different modalities. This machine has a combination of electric muscle stim, which breaks up muscle spasm, very, very deep though, deep muscle spasm, and then interferential, which is a slower pulse, but that brings new blood to the area that helps to heal it. And then it does electroanalgesic at 5,000, 8,300, or 10,000 pulses per second. Like a TENS unit will go to 150, 200 cycles per second. So what's the difference in the speed? The speed is so fast that it prevents the nerve from regrouping. Because in order for a nerve to fire, sodium has to go out of the cell, potassium has to go back into the cell, and that generates an action potential generated along the nerve. It's called depolarization, repolarization, hyperpolarization. And there's a period of time where the cell needs to regroup, and if you hit it with a frequency so fast, it doesn't allow the cell to do that. So this is a great machine. There's a vasopneumatic component. That means that these stick under suction. Some people think it's cupping. It does have cups involved, but it's very different than acupuncture cupping. So Matt's getting a electroanalgesic therapy right now on his low back. These are on here real good. Some people think this is cupping, but that's an acupuncture technique. It does have cups on here. And the bottom part of the machine is a vasopneumatic component. So basically it'll pulse, pulse, pulse. Right now we're on program 1, which is 10 minutes. He's got quite a bit of juice going into him. That's almost 80 millivolts. But it's very comfortable, right there, Matt?
Yeah, I
all right.
Even use one.
All right, how's that feeling?
Yeah, it's powerful.
All right,
it's really hitting the spot.
So I can do this on shoulders, elbows, wrists, knuckles, hips, knees, ankles, toes. All right. So if you have a joint problem, this is a great piece of equipment in combination with the other therapies that I have here, like the Pro Adjuster